Our phase 2 study with Brentuximab Vedotin was designed to address those high-risk patients who were receiving their first-line treatment, where the goal really is to get a great response and then never relapse. So we're treating with curative intent. And in those high-risk patients, we had known that there was some single-agent activity of Brentuximab Vedotin in diffuse large B-cell lymphoma. So this was a closer look at what that drug might add to the combination of R-CHOP. Initially, we took all patients with that high intermediate or high risk diffuse large B-cell lymphoma and further characterized their cells while their treatment was ongoing. And we started with a 1.2 milligram per kilogram dose of Brentuximab Vedotin in combination with R-CHOP, and then increased to 1.8 milligrams per kilogram. The patients did pretty well, but did have febrile neutropenia and peripheral neuropathy. The outcome from those patients was reported at ASCO, and the summary that we were able to present with longer-term follow-up and with a cohort that was limited to CD30 positive was reported at this ASH. So in this ASH, we reported on the combination of R-CHIP, so that would be rituximab, cyclophosphamide, doxorubicin, but we omitted the vincristine to address the overlapping toxicity of peripheral neuropathy that Brentuximab Vedotin shared with vincristine. So adding Brentuximab Vedotin and limiting it to CD30 positive patients with R-CHIP was the main talk of our look at safety for this meeting. And that combination and elimination of vincristine was very successful. There was less neutropenia, and the peripheral neuropathy really dropped substantially in incidence and severity. So that would be the basis for going forward. But when we looked at all of the patients, we found a remarkable improvement in outcome. Statistically speaking, I shouldn't say remarkable, I suppose, because the sample size is small. But in that group altogether of around 50 patients, we did see that the 2-year PFS was 79% for the CD30 positive patients and in the 50s for the CD30 negative patients. So what we can say is that Brentuximab Vedotin had an improvement in the outcome of those patients whose diffuse large B-cell lymphoma was CD30 expressing.